Hi, I'm John Schorge. I'm the chair of OBGYN here at Regional One Health. I'm also a professor at the University of Tennessee Health Science Center. I am a GYN oncologist providing care for the gynecologic cancers for women in the community. It's important to raise awareness about ovarian cancer because it's a very insidious disease that comes on slowly, and a lot of people that develop the cancer have had symptoms for many months and knew that something was wrong, but they never got a doctor to do an internal pelvic exam, and so their diagnosis was delayed. The importance of early detection is that the earlier you're diagnosed, the more likely you are to survive the diagnosis. And so people with stage 1, which means it's just confined to the ovary, have a 90+% chance of beating this cancer. The risk factors are mainly 2 items. Number 1, genetics. So if there's somebody in the family that has had ovarian cancer before or breast cancer before the menopause, those are women that are at risk. Secondly, anything that causes pelvic inflammation causes an increased risk for ovarian cancer down the road. So those are the 2 things to be aware of. You would have some pelvic pain, some bladder dysfunction, feeling full all the time, and feeling bloating. So those are the 4 symptoms that you should be aware of and bring to your medical provider's attention. The treatment options either start with chemotherapy, which is a drug that goes in your vein and you typically lose your hair. That's how people know of chemotherapy, or starting with an operation. And prior to 2 years ago, at Regional One, we did not have the ability to treat patients with ovarian cancer or any GYN cancer. And so myself, as a GYN oncologist and a specialist, what we do know is people with ovarian cancer have a better outcome if they're seen by a specialist. And we can now provide surgery here at Regional One. We can now provide chemotherapy. We can provide the total care for ovarian cancer that we weren't able to do 2 years ago.